you have arrhythmia, your doctor will prescribe medicine to help control your arrhythmia and control your heart rate better. Therapy can you use for acute sarcoidosis, hemochromatosis, amyloidosis. I already touched upon those diseases earlier. Okay, differential diagnosis. What is that? It's a systematic method that doctors use to diagnose patients that don't have unique symptoms or signs. And in this case, constrictive pericarditis is very often mistaken for restrictive cardiomyopathy. In clinical cardiology, it has been a perennial problem, so this is why I want to talk about it and try to get you guys to know the differences between this disease and mine, or the one I'm covering. So here is actually a picture of constrictive pericarditis. You can see that, okay, we learned this, the pericardial sac is the covering of the heart. So what constrictive pericarditis is a chronic inflammation of a sac-like covering of the heart, or the pericardium, and it's thickening, scarring, and muscle tightening. So you see here there is scarring and scarring here on the pericardial sac. This is your heart muscle. So constrictive pericarditis, and the reason it's so crucial that you differentiate between restrictive cardiomyopathy and constrictive pericarditis is because the treatments are completely different, and that can make all the difference. And here's an example. Constrictive pericarditis requires surgical treatment, and it's usually curable. So that's why you don't want to do a surgery on someone who doesn't need it. So it's obviously a very big point here, differentiating. Restrictive cardiomyopathy, short of a cardiac transplantation, which I talked about, if it's severe enough, it will give you a heart transplant. It's treatable only by medical means, and like I said, medicine is just to slow it down. It doesn't actually cure the disease. Whereas constrictive pericarditis is curable. So many differences that exist between the two conditions. There are, but no one diagnostic method can be used. You can't just run one test and say, oh, there is one, that's one or the other. You have to run a variety of tests. I'm going to show you a slide with all those. A myocardial biopsy, or a biopsy of the heart muscle. Kevin talked about this, touched on it earlier. They basically take a small tissue sample from your heart, and they examine it under a microscope to determine the cause of your symptoms. And that's how they tell if you have restrictive cardiomyopathy and constrictive pericarditis. And here's a whole list. I'm not going to obviously read through all these because by the time I get here before, you guys probably all be asleep. So I'm just going to talk about this one right here. I touched on earlier, atrial enlargement. I remember I talked about if your ventricles are not working properly, your atriums are forced to work harder, and that's the atrium enlargement. So in restrictive cardiomyopathy, you can see that it is pronounced in most cases, whereas it's not very prominent in constrictive pericarditis. And here's a whole list of other tests that they will run, and here are the results you would get for each of these if you want to look at them. All right, let's talk about a little bit of the history. As idiopathic cardiomyopathy was evolving, a man named J.F. Goodwin in 1961 classified the three types we're talking about today, known as hypertrophic, restrictive, or it was called constrictive cardiomyopathy, was later named to restrictive, and dilated cardiomyopathy. And dilated and hypertrophic have become more well known, but restrictive is still very less common. You won't really hear about it. I mean, I didn't know about it until I actually started researching it. And the definition is very much throughout the years. There hasn't been a clear-cut definition of restrictive cardiomyopathy. It's gone from amyloidosis, hemochromatosis, tropical endomyocardial fibrosis. There's a whole list right here, and there's probably more. But whatever definition of restrictive cardiomyopathy is used, it's clear that patients who actually get diagnosed with this are very rare. And that's just explained through the fact that it's a very uncommon disease. You won't go into a cardiologist's office and explain those symptoms, and they're going to diagnose you with cardiomyopathy restrictive version, just due to the fact that it's very rare. Also, I'm going to, in conclusion, okay, prognosis for restrictive cardiomyopathy is grim, but it's not necessarily a terminal death sentence. But I believe that preventative medicine is the best medicine, like the old saying goes. So by making positive lifestyle changes, cardiomyopathy and other heart diseases can be prevented. Eating a healthy diet, maintaining blood pressure, controlling blood pressure, and avoiding alcohol, illegal drugs, and sometimes just using flat-out common sense can help prevent or steps you can take to maintain a healthy heart. So at the end of the day, this is just advice. It's up to you to be smart and take care of your own body.
We're not done yet.
Yeah, that's my presentation though.
Just for fun, I just gave you guys a quiz, just because I'm like that. So you don't have to put your name on or anything like that.
It's good.
Thank you.